Good morning, Your Excellencies, ladies and gentlemen. A very warm welcome to you all on behalf of the IPB. We're very much looking forward to supporting you during today's UN Friends of Vision webinar. I'm now delighted to hand over to Ambassador Webson to welcome you to the webinar. Thank you.
Good morning, Excellencies, colleagues. Good afternoon to those who are in Europe, and maybe even good evening to those who are yet further afield in this connective world into which we are now becoming more and more accustomed to working in. Welcome to this high-level meeting of the Friends of Vision. We are delighted and honored by the presence of so many colleagues, so many excellencies. We are delighted to have with us the Executive Director of UNICEF. Welcome, Henrietta. We are delighted to have the Foreign Minister of Antigua and Barbuda, the Honorable E.P. Chet Green. And we are delighted to have the leaders of many civil society organizations, many ambassadors online, and we are extremely honored by your presence. Today, my co-chairs and I are extremely happy as we continue to move the discussion and to continue to push for action on the challenges we are facing as a globe on vision and vision loss. It is important within the context of the SDGs, within the context of universal health, and within the context of the work we do, not only here in New York, but around the globe as we attempt to help those who are fighting issues of climate change, fighting issues of poverty and education, and using the need for good sight and vision opportunities to be a major part of that struggle. Today we have a number of speakers lined up, and we'll begin by bringing you greetings and an address by our co-chairs. I will begin with Ambassador Robert Fatima of Bangladesh, one of our co-chairs, who will address you. Ambassador, you have the floor, please.
Thank you very much, Ambassador. Honorable Minister, Excellencies, Ms. Ford, distinguished experts, dear colleagues, good morning. And I'm very pleased to join Ambassador Webson and Ambassador Nelson and other co-organizers to thank you for joining us, our event this morning. I especially want to thank the supporting agencies and the expert panelists for their kind presence and support. The theme of this year's World Sight Day is Hope in Sight. We convene here today in the hope that our actions would result in reaching those 1 billion with a vision impairment that could have been prevented or yet to be addressed. Excellencies, the scale of the problem of vision impairment is much bigger. More than 2 billion people around the world are either suffering from blindness or lower vision. 3/4 of these are preventable or treatable. And 90% of those who are blind live in the low and middle income countries. Sight loss has substantial economic implications for affected individuals, families, and communities, with an estimated global loss of $3 trillion. Vision impairment and blindness are pervasive and touch every corner of the globe, yet access to care is not equal across the world or within a country. Such disparities, of course, calls for transformative actions to ensure a world in which nobody is needlessly visually impaired, where those with unavoidable vision loss can achieve their full potentials. Dear colleagues, vision facilitates many activities throughout our life course. Improved eye health offers the potential to advance progress towards the SDGs, mainly through its link to Goal 3, which is health and well-being. But it is cross-cutting and touches upon many other goals. And available and by removing the disparities within a country, across countries in the availability and access to eye care services, if we can actually touch upon that, it will have an impact on all those goals. Available evidence suggests that corrected vision can increase half year's equivalent schooling in a calendar year for a child, or boost the productivity of about 22% and reduce road traffic accidents by 60% in some countries. Dear colleagues, thanks to greater awareness and concerted actions over the past decades, progress has been made in many areas of vision care. Vision 2020, the right to sight, to intensify global advocacy efforts and strengthen national prevention of blindness programs was a major initiative. The World Health Assembly adopted 4 resolutions in 2003, 2006, 2009, and 2013. WHO also undertook Universal Eye Health, a global action plan 2014 to 2019 for universal access to comprehensive eye care services and to reduce preventable vision impairment by 25% in 2019. Excellencies, dear friends, our group, the Friends of Vision, has made some difference in the past couple of years, especially in raising awareness among member states and in the wider UN community. We made good progress last year at last year's high-level meeting on universal health coverage, where global leaders promised to make eye care health integral to universal health coverage. With the support of our NGO partners, we also organized a successful eye screening event at the UN. These are important progress in terms of raising awareness. And I wish to thank Ambassador Wapson. It was his singular leadership and commitment that has made this possible. But clearly much more remains to be done. Significant challenges remain. Notable among them are inequalities in coverage and equality, addressing unmet population needs, workforce shortages, poorly integrated eye care into health systems, gaps in data, and lack of implementation of research related to eye care. These are compounded by population aging, coupled with lifestyle changes, causing the number of people with vision impairment to increase. Meanwhile, COVID-19 has posed additional challenges. As we emerge from the current crisis and address the impacts of the pandemic, we need more sincere efforts and real-time actions by national governments to achieve vision care targets. Our success hinges on our shared endeavors. In this last decade of action, we must show demonstrable progress. There must be political will and commitment to strengthen eye care. We need to translate into action the commitment made at last year's high-level event. And towards that end, we are now working towards the first ever UN resolution on vision health. We are very encouraged by the good support and response that we have already received. We expect and we hope that we can adopt in this landmark 75th UN General Assembly session, with the support of all member countries, a comprehensive resolution on eye health care, and we will need the support of all. And let us pledge that at this 75th session of the United Nations, let us pledge to change the way the world sees vision care. I thank you all once again for joining us and for your support throughout. Thank you.
Rabat Fatima, Permanent Representative of the Mission of Bangladesh. Thank you, Excellency. I will now give the floor to another very good friend of mine, Ambassador Geraldine Bernstein Hassan, the Permanent Representative and Mission of Ireland. Probably the first time, Geraldine, you've ever heard me call your name in full. My dear friend, Ambassador, you have the floor, please.
Thank you very much indeed. And it's a complicated name, Aubrey, so Geraldine is just fine. It's a real pleasure to be with you all this morning. Certainly I can see from the participants here, it's very encouraging to see for what is early morning in New York, so many committed friends and colleagues turning out this morning to underline how important we see this. And I want to congratulate Ambassador Aubrey for the way in which this group of friends at the UN, group of friends of vision, has really gone from strength to strength. And picking up on what we've just heard from my great friend Rabab also, we know that what Bangladesh and Ireland are doing in supporting this group of friends as co-chairs is a very important task. And we really hope that this year at the 75th, the poetic in a way, anniversary of the UN, we will step this up again by seeing a resolution here at the UN, which is a landmark step for shining a light on the importance of the issue we're dealing with today. I can think of no better way right now for us to mark World Sight Day than to be bringing together so many of you on screen here, leading experts in the field who can work on accelerating vision and our common objectives for everyone from this year on. Today, we've heard from Rabab a very comprehensive presentation of the scale of the challenges ahead of us. And we know that in this ongoing pandemic situation, world across the globe, there's been an interruption in terms of access to essential services. We know we need to take a look at that very clearly in the context of eye health globally, and in particular in the opportunities that there are for all of those who are vulnerable in this context to access the much needed services. So I think that even if we knew before COVID we had a big task, the urgency of the task right now is really underlined. Before the pandemic, Rabab referred to it, 2.2 billion people we know globally were living with vision impairment. For me, the real shame of that is that at least 1 billion of those 2.2 billion people across the globe could have been saved from impairment. So my message at the beginning of this is to say that inaction on our part costs, and the cost of impairment and sight loss are just irreparably high cost to pay. And we really here at the UN want to act to interrupt that awful suffering that we see happening in many cases in a needless way globally. I'm really glad that we're here with Henrietta Foy of UNICEF, really champions of the effort to ensure that the most vulnerable, our children, are helped in this regard, given access to strong, resilient, inclusive healthcare systems. We know that our children fully deserve that support, and UNICEF really do stalwart work in that regard. I'm also really happy to see online Sight Savers. Ireland works very closely with you, as you know. We have joint projects underway in Sierra Leone and Liberia, Guinea, Cameroon, Mali, and Senegal, where we're working together to prevent and to cure blindness, but crucially also working on the ground with you in granting greater access to inclusive and quality education for visually impaired children. Teachers are also being trained on the ground in our joint projects. And I wanted to highlight the importance also of working with government officials and civil society members, because we see those as important routes also to help promote the rights of children with disabilities. You'll pick up from me as an Irish person that we put a huge premium on the fundamental importance of access to education, and that this fits in very much with our commitment to the work here with the group of friends on vision. So my if you like, the segue to that point is to say that eye health is about so much more than one SDG, which is often the Sustainable Development Goal 3 on good health and well-being is often the one that we point to. But of course, we know that what we will talk about today is a much wider agenda. We know that giving a child eyeglasses will dramatically impact on the quality of education that child can receive. We know that poor eye health directly contributes to road accidents, 60% of them. We know that eye health directly impacts on the ability of so many people across the globe to access decent work, and therefore also contribute to economic growth in their own countries. And we know that poor eye health is both a cause and a result of fundamental inequality, often for the most vulnerable in our societies. And there we constantly refer to women, children, older people, and people with disabilities, as well as ethnic minorities and indigenous populations. So our firm conviction in the way we do our work as Ireland and as a co-chair of this group is that eye health is not really just the preserve of health experts. It's something that impacts right across our societies, our economies, our children's future, and the well-being of our entire populations. So it's a fundamental part of realizing that great dream of delivering on the 2030 agenda. In this difficult global context, our view is that this task couldn't be more important, nor indeed more urgent than ever. So my final sentence and message to you is that we need to get on with the job. Thank you very much.
Thank you, Excellency. Thank you, my friends. We have had two very strong presentations by Ambassadors Fatima and Bernstein. We have had some very strong comments and sharing and acknowledging where we are and acknowledging where we need to go. And as Geraldine said, we now need to continue. We need to get on with the work. There is a lot to do. Geraldine and Fatima, both, thank you very much. Tying eye health to the SDGs, not only as a health matter, but the broader issues that surround the fulfillment of that, leaving no one behind, was aptly brought out in your presentations. Whether it is SDG 1, to addressing the question of poverty, SDG 3, addressing the questions of health, or 5, addressing the question of gender, or inequality, SDG 9. We can name all of them, 7 or 8 SDGs, and tie it to eye health and the broader inclusion of services for persons who are visually impaired, as well as for our efforts towards universal health and eye health for all. We are very happy and very fortunate to have with us this morning, as amongst our keynote speakers, a dear friend of mine and the distinguished and honorable representative of my constituency in Antigua and Barbuda, the Minister of Foreign Affairs, Trade and Immigration, the Honorable E.P. Chet Green. Minister Green will now make an address to us. Minister Green, you have the floor, please.
Thank you, Excellency. Excellencies, ladies and gentlemen, I bring you warm greetings from the Caribbean island of Antigua, and thank you at the same time for inviting me to address you at this most important event. Let me first congratulate you on the tremendous work you've done so far in bringing the issue of health vision to more prominence at the United Nations. With this development, we can now find a way of discussing and accelerating discussion and progress towards achieving the Sustainable Development Goals, while contributing at the same time to a more equitable recovery from COVID-19 pandemic. We are all facing many challenges now, and trying to limit the spread and destruction of this global pandemic while preparing for recovery consumes significant time and resources from every government. The 2.2 billion people worldwide with vision impairment presumably still have that impairment, and know that they have the added risk of COVID to consider. In other words, we have many challenges. And the COVID virus has served to shine a bright light on inequalities everywhere. Recovery will be a long and difficult road. We should not make it any more difficult by neglecting to address issues which have the potential to boost our global recovery from the pandemic, helping us to come back in a fairer and more equitable manner. Vision, in my opinion, holds that potential. And in that context, I'm absolutely sure that my expert colleagues in this panel will agree that one doesn't have to be an economist to understand how people with healthy vision can help to fuel economic growth. And I think this is our mission. One doesn't have to be an expert on education to see just how a child can more easily reach his or her potential if vision challenges do not go undetected or untreated. The WHO, I must admit, has been doing an excellent job, most recently through the World Report on Vision, helping to shine a light on this global challenge. And the present recommendations for how to address it. But improving vision, in my opinion, requires a whole of government approach, one which considers education, labor, economic development, trade policy, and gender to include other facets of government. And while COVID might have slowed humanity's progress on many fronts, it has also given us opportunities. And in this instance, I advocate an opportunity to reset, to recover, and to recover better. Vision for everyone, I dare suggest, can help us do just that. Excellencies, ladies and gentlemen, I highly commend this forum, this important meeting, and the mission of vision as eschewed by this organization, Friends of Vision. Have a great day, and I wish you all the best in the deliberations.
Thank you, Minister Green. Thank you for your very kind comments and your remarks and the commitment I know that you and your government have towards vision and towards universal health, and your continued encouragement to the work of the Friends of Vision. We have another very enthusiastic and important friend and colleague with us. Henrietta Foy is the Executive Director of UNICEF, and Henrietta has been a tireless advocate for children and for the rights of children and the need for children to be given equal opportunities and a chance within achieving the SDGs, and more importantly, a full and equal chance if given the opportunity to play the role that we expect our youths to play in the development of our societies. Henrietta, thank you for being with us. The floor is yours.
Thank you very much, Ambassador Webson. It is a delight to see you, my friend, this morning. So to the co-chairs, Ambassador Fatima, to Ambassador Byrne Nason, Minister Green, ASG Simonson, and Director Burton, honored guests, ladies and gentlemen. On behalf of everyone at UNICEF, it is important and a wonderful honor to join you on World Sight Day for this important discussion. Our deep thanks to Ambassador Webson for bringing all of us together. He is an extraordinary role model for all of us, and we thank him for his leadership and guidance during his tenure on the UNICEF Executive Board to help our organization become more accessible and inclusive. We are proudly continuing this work. We are supporting our staff members with disabilities with more accessible premises and platforms and workplaces around the world. And we're weaving the needs of children with disabilities across our country programming. And this includes the needs of children with vision impairments. We know that vital vision is an important aspect of a child's life and a child's development. I've worn glasses all my life and know how difficult it is to keep up with full-sighted children at home and at school. For a child, it helps them connect with their parents and caregivers. It supports their learning and growth. And it's the foundation of their communication skills and their ability to become independent adults. So identifying and addressing visual impairments as early as possible is crucial. If we do not, the evidence clearly shows that many negative effects to children, development delays, and lower educational outcomes and decreased workforce participation. And that is why UNICEF is putting a strong focus on 3 key areas where we can support children's vision. Early screening and intervention is number 1. Number 2, assistive devices. And number 3, inclusive education systems. So on early screening and intervention, UNICEF is working with governments around the world to build their capacity to identify which children may be at risk of vision impairment. This includes training local health workers in early screening and delivering key interventions like nutrition treatments that can support good vision. And it includes our work with governments to strengthen the availability and quality of disability data. To help children with disabilities, we need to know where they are and what their needs are, and this work will help us to do that. Number 2, on assisted devices and products, we're ensuring that children with visual impairments can access learning and education that they both need and deserve. This includes our leadership role in the Global Partnership for Assistive Technology. We want to reach 500 million people with assistive technology by 2030. Our supply division has provided over 138,000 children with disabilities with devices and products, including braille equipment, wheelchairs, and hearing aids. And our work on digital learning is rapidly moving forward, especially in this age of the COVID-19 pandemic, in which digital learning platforms are absolutely essential. We're making strong progress in our work on accessible digital learning through our Accessible Digital Textbooks project. And we're partnering with innovative companies to develop and deploy accessible digital content for children with disabilities, no matter where they live. All of this work will help us accomplish our 3rd area of need, truly inclusive education systems. We must continue breaking down the barriers for children with disabilities, including visual impairments that stand between children and their ability to learn. We can all call on countries to continue investing in this need and adapting their education systems to serve all children equally. As the world looks to strengthen systems for the future in the wake of the COVID-19 pandemic, let us leave this discussion united in our commitment to ensure that all children with disabilities, including those with visual impairments, do not get left behind. Their education, their opportunities, and their futures depend on our support. We must not let them down. Thank you very much, Ambassador Webson.
Thank you very much, Henrietta. Again, we are committed to the work of UNICEF. We are in awe of the work you and your team do in helping and saving so many children around the world, and your efforts towards bringing to those who have challenges with vision, bringing opportunity, and the efforts towards creating an opportunity through assistive devices or early screening and detection. We thank you for the part that UNICEF plays. Without UNICEF, we would be such a poorer place. Thank you and your team again. We'll have another address by ASG Simon, and welcome of WHO in New York. We certainly appreciate you being here with us. Working with WHO has been another of the highlights of the Friends of Vision in the past year, and the efforts of the members of the WHO who has helped us in guiding us when we worked on the universal health resolution, where we got for the first time vision included, was as much due to the support we received from WHO as it was from our members. ASG Simon, the floor is yours.
Thank you, Ambassador Webson. Excellencies, colleagues, friends. The World Health Organization appreciates being included in this important event, and it's an honor to follow Henrietta Foy. UNICEF is a great partner of WHO and has done magnificent work in this area, and we're proud to be associated with them. If the COVID-19 pandemic has taught us anything, it is the importance of strengthening health systems to provide health for all. And this lesson has particular meaning for vision health. The first WHO World Report on Vision, released more than a year ago, strongly recommended strengthening health systems so that eye care becomes an integral part of healthcare service delivery, and all people obtain eye care services they need without financial hardship. My colleagues and I are so encouraged by member states' support for the recommendation of the World Report on Vision. Indeed, the World Health Assembly in Resolution 73.4 adopted in May calls for integrated people-centered eye care, including preventable vision impairment and blindness. Today's event is further evidence of member states' support for vision health. And this support is sorely needed because the field of eye care faces substantial, daunting challenges. Globally, at least 1 billion people have vision impairment that could have been prevented or has not yet been addressed. Of these, at least 16 million people live with vision impairment or blindness due to glaucoma, corneal opacity, diabetic retinopathy, and trachoma. All of these conditions could have been prevented through early detection and timely management. Approximately 65 million people live with vision impairment or blindness that could be corrected through access to cataract surgery. And more than 800 million people live with a distance or near vision impairment that can be easily addressed with the appropriate pair of spectacles or eyeglasses. These numbers are a call for action. We need to act strongly and unyieldingly, and we need to act now. This urgency is amplified when 4 factors are considered. First, the global demand for eye care is set to surge in the coming years due to population growth, aging, and lifestyle changes. Second, and not surprisingly, the burden of eye condition weighs heavily, most heavily, on the poor, migrants, indigenous people, persons with different kinds of disabilities, and those who live in rural communities. Untreated eye conditions can mean catastrophe in these contexts for the individual and for the family. Third, there are effective interventions to address needs associated with eye conditions and vision impairment. For example, cataract surgery and glaucoma surgery and spectacles or eyeglasses are among the most cost-effective and feasible of all healthcare interventions. And fourth, vision impairment poses an enormous global financial burden. For example, the annual global productivity losses associated with vision impairment from uncorrected myopia, presbyopia alone are estimated to be 244 billion US and 25 billion US respectively. The eye care sector is well placed to address these challenges. It is a mature field with strong and coordinated advocacy. Recent scientific and technological advances have led to improvements in diagnosis, management, and treatment of eye conditions and vision impairment. Thanks to implementation of the large-scale public health initiatives, substantial progress has been made in addressing the infectious disease causes of blindness, such as trachoma or onchocerciasis. And the eye care sector has a strong tradition of epidemiology and clinical research. Building on these strengths, we need to ensure that as we move forward, eye care is an integral and integrated part of the broader health sector in all countries of the world. WHO is committed to making this a reality by focusing on 3 enabling factors for implementing integrated, people-centered eye care. First, improved delivery of eye care, in particular through primary health care. Second, improved health information systems for eye care. And third, a strengthened eye care workforce. WHO and our UN partners cannot achieve this alone. Member states, international organizations, donors, the public and private sectors must work together to provide the long-term investment, management capacity, and importantly, leadership to scale up integrated, people-centered eye care for all. Thank you.
Thank you, ASG Simon, for your greetings and for your words, your address. We continue to look forward to our work together with the WHO. And as we progress the discussions, particularly, I'm sure WHO would be very helpful as we continue the discussions around the resolution on eye health, which was made reference to by Ambassador Rabat Fatima in her earlier address. We'll now move to a little bit more of the technical presentations, and I will ask Matthew Burton, co-leader of the Lancet Global Health Commission on Global Eye Health. And Matthew is also the director of the International Center of Eye Health. And we'll ask Matthew to make a presentation. We are already, Matthew, running on time, out a little bit behind time. The floor is yours, Matthew, please.
Excellencies, ladies and gentlemen, thank you very much for this opportunity to address you today. 2020 is a pivotal year for vision and eye health. It marks the culmination of the global initiative Vision 2020, the right to sight, which alongside several World Health Assembly resolutions and WHO action plans, provided the framework over the last 2 decades for national programs to address eye health. In 2019, WHO published the first World Report on Vision, and its key strategies were endorsed by the World Health Assembly in 2020. The report calls for the advancing of eye health as an integral part of universal health coverage through the implementation of integrated people-centered eye care. Later this year, the Lancet Global Health Commission on Global Eye Health will be published. The Commission report is the work of an interdisciplinary group of 73 academics, national program leaders, and practitioners from 25 countries. Building on the World Report on Vision, the Commission analysed many aspects of eye health in 2020 and beyond. And today I would like to share with you a number of observations which we trust will be of interest. The Commission examined the importance of eye health from several perspectives, including the impact on quality of life, general health, well-being, and mortality. Our starting point was an investigation of the relationship between improving eye health and the impact of this on the Sustainable Development Goals. We found multiple connections. In this diagram, the solid green arrows radiating out from improved eye health indicate direct effects, and the black arrows indirect benefits. Our overall conclusion is that improving eye health and reducing vision impairment is an important, if not essential, enabler to the achievement of the SDGs. Briefly, we found evidence that the provision of eye care services is associated with improvements in workplace and economic productivity, household consumption and income, and employment. The resulting economic benefits, particularly when delivered in resource-limited settings, contribute to advancing the SDGs on poverty reduction, food security, and decent work. For example, a trial showed that provision of free spectacles to tea workers with near vision impairment in India improved workplace productivity by 22%. Impaired vision and eye health have a broad impact on general health and well-being by exacerbating other conditions. For example, through reduced access to healthcare, increased cardiovascular disease through limitations on physical activity, and exacerbating depression and dementia. Encouragingly, evidence indicates cataract surgery can slow rates of cognitive decline. Vision impairment and eye health are often perceived to have little effect on mortality. This figure summarizes the findings of a meta-analysis performed by the Commission. The blue boxes represent individual studies. Where a box lies to the right of the vertical line, vision impairment is associated with increased mortality rates. When similar studies were combined, the mortality rate for mild vision impairment or worse was 1.3 times, for moderate or worse 1.5 times, and for severe vision impairment or blindness, it was 2.6 times. Multiple studies have found that addressing eye health needs in children is important to learning. For example, several randomized trials have demonstrated that provision of spectacles improves academic outcomes. Women carry a greater proportion of vision impairment than men. Addressing vision impairment and improving eye health is relevant to both gender equality and reducing inequalities in general. A study from Kenya, Bangladesh, and the Philippines found that people with vision impairment from cataract were both poorer and reported a lower quality of life than their neighbors. 1 year after surgery, this gap was gone, with no difference in markers for poverty such as household expenditure. SDG 3 and SDG 11 include targets to reduce road traffic injuries, a leading cause of death in children and young adults. Multiple studies report associations between some eye conditions and motor vehicle collisions, whereas cataract surgery leads to reduced driving difficulties and fewer collisions. Globally, healthcare contributes around 5% of greenhouse gas emissions. Eye care as a high volume service is probably a significant contributor to this. The Commission found limited research on the environmental impact of eye healthcare delivery. However, practices can vary substantially. For example, the upper picture shows disposable waste from one cataract operation in the UK, 2 sacks, and the lower picture from 32 equivalent operations in India, 4 sacks. The UK CO2 emissions were 23 times the Indian emissions per operation. This suggests substantial opportunities to reduce the environmental impact of eye healthcare delivery, which requires further research. Having noted the broad relevance of eye health to multiple SDGs, how big a problem is vision impairment globally? Recently, new estimates for the numbers of people affected by vision impairment in 2020 have been produced jointly by the Vision Loss Expert Group and the Global Burden of Disease Study. These indicate that worldwide there are 1.1 billion people living with current vision impairment, the large majority of which have a condition that can be either treated or prevented. This includes 43 million people who are blind, 295 million people who are moderately or severely vision impaired, 258 million with mild distance vision impairment, and 510 million with uncorrected near vision impairment. These graphs show the global trends in the estimated numbers of people with vision impairment from 1990 to 2050. Despite work to scale up eye health services around the world, the numbers affected are forecast to rise substantially as need outstrips capacity. These increases are partly driven by aging of the world population. By 2050, it's estimated that there will be 895 million people with unaddressed distance vision impairment and a further 865 million with unaddressed near vision impairment. This graph illustrates the excess number of women over men that are affected by vision impairment in every world region. The persistent age standardized gender difference suggests the greater vision loss experienced by women is in part socially determined. However, these numbers are only part of the picture. There are at least another billion people who require ongoing eye care services who are not captured in this data. For example, all of us attending this meeting who use glasses or contact lenses will periodically need services to update our prescriptions. And people with diabetes, an estimated 450 million worldwide, should be regularly checked for diabetic retinopathy. As part of the work of the Commission, we explored aspects of the economics of vision, and we developed a new estimate for economic productivity loss attributed to vision impairment, using the latest data on the number of people with unaddressed distance vision impairment in 2020 and the latest World Bank GDP data from 2018. We estimated the global economic productivity loss to be $411 billion purchasing power parity per annum. The good news is that there are cost-effective interventions for the large majority of people with unaddressed vision impairment. Cataracts and uncorrected refractive error account for 79% of this total. We conducted an updated cost-effectiveness analysis for interventions for these two conditions, and both are highly cost-effective. It is really important to ensure equitable access by making these services affordable. In the World Report on Vision, WHO estimated that the combined cost of addressing these two conditions for moderate vision impairment or worse would be in the region of $14 billion. In conclusion, we found many studies providing consistent evidence that improving eye health can contribute to advancing multiple sustainable development goals. The Commission urges the international community to consider addressing population eye health and vision impairment as a powerful enabler for sustainable development. The magnitude of unaddressed vision impairment is very substantial at around 1.1 billion people worldwide. In addition, there are many more people who need ongoing eye health services. These numbers are only set to increase. The annual global economic productivity loss from vision impairment is $411 billion, yet the large majority of vision impairment can be addressed through highly cost-effective interventions. The evidence in favor of urgent global action on eye health is compelling. Thank you very much.
Thank you, Matthew, for this sobering bit of information. The staggering statistics that you have laid out before us tells us how much work there is to be done and how seriously we ought to take this challenge before us. We know that while the economic cost, as you have laid out, is staggering, the most critical cost is the quality of life of individuals as we work to leaving no one behind. Thank you, and you and your group, we look forward to the full publishing of the material so that we have an opportunity to put that in play with our governments at all levels. Having had such a sobering presentation and information to awake us and let us sit up and absorb the next step, we thought we would lighten it up a little bit by presenting a short video clip by a comedian, Stephen Fry. And this clip was put together by our friends from Clearly. Can we have the video, please?
What if there was a product that could dramatically improve the lives of billions of people? A product so small, it could fit into your pocket, but so powerful, it could change the way you see the world forever. Clearly, this would be the greatest invention of all time. We took a small piece of refined liquid sand, just 3 millimeters thin, and using a mixture of xylonite and titanium, we were able to mount these discs on a structure that was unbelievably strong, fantastically lightweight, and devastatingly beautiful. Introducing Eye. A revolutionary design so simple, so graceful, it will completely change the way you think about how you use your face. By inserting your nose into the nose dock and engaging the ear-mounted stabilizers, Eye begins working instantly, and the resolution is just life-changing. By combining...
Sorry, excuse me, sir, but aren't those just glasses? Glasses, look like I'm wearing now. Here.
What? Who are you working for? You people, you think you're so... Can you call that a nose job?
Out of the mouth of babes, right? Children will tell us the truth. Thank you very much. So we'll move on quickly as we are a little behind, and to moderate our panel discussion is a very good friend and a long-standing advocate and leader in the field of fighting for the world's vision, and fighting to assist to support the world's children and people with visual impairment. Caroline Harper, the CEO and director of Sight Savers International. Caroline, please, you have the floor.
Thank you very much, Ambassador Webson, Aubrey. It's wonderful to see you, and thank you so much for everything that you're doing now with the Friends of Vision. It's really brilliant to see this really taking off. I'd also like to thank Ambassador Byrne-Nason for her kind comments about the work that we're doing in partnership with the Irish government. The Irish government have been supporting eye health and disability for many years, and brilliant to see that happening. Thank you very much. So what I'd like to do now is introduce the panel. So the first member of the panel we have is Dr. Alakos Chiedza. Alakos heads up the WHO unit that's doing sensory functions, so the vision area, also hearing disability. And Alakos was the person who drove through the World Report on Vision. She was responsible for making that happen, and that's really fabulous. And then alongside Alakos, we also have Reshma Dabadine. Reshma is the Global Medical Leader and Director of Africa Programming at OneSight, which is an NGO. She's worked in a number of NGOs over the years. And then we also have Rosangela Berman-Bieler. She's the Senior Advisor on Children with Disabilities at UNICEF. But Rosangela is also a very staunch disability rights advocate and a journalist from Brazil. So I think that's a fabulous panel that we have there. So, I mean, just to say, Sight Savers has been working in this area for well over 70 years now. Obviously see it's extremely important. And we were very excited to see the World Report on Vision and also to see the World Health Assembly resolution coming. And so pleased, and thank you to the co-chairs for putting forward this resolution at the UN. Really hope that goes through. Thanks very much for doing that. But I have to say, despite all those tremendous things, I am worried. You know, with COVID, we are, I guess, seeing that global health and universal healthcare is up the agenda internationally, is seen as more important than perhaps it was. But I am very concerned that eye health may get lost in the noise around this pandemic, and we may lose momentum. So I'd start my first question to Alakos, and I'd ask Alakos, brilliant, the World Report on Vision, but what is the relevance of that now, and does it need to be changed in the light of COVID?
Thank you, Caroline, and a great honor to be here with all of you. No, the main message of the World Report on Vision was relevant before the pandemic, is extremely relevant during the pandemic, and will be extremely relevant after. The main message, as we have heard, eye care needs to be integral part of the health sector and integral part of universal health coverage. We have, as we have shown in the report, that is the main reason why still over 1 billion people are living with a vision impairment that could have been prevented or is still to be addressed, because eye care is not part of the health sector, and basic interventions of eye care are not provided as part of universal health coverage in many countries of the world still. So that was the relevance before the pandemic. During the pandemic, we see that if for those countries in those settings which eye care is integral part of the health sector, still eye care services have been provided as part of essential health services. If you are part of the system of the health sector, you are part of the response, and you are part of the response strategic plans that countries have been putting together. And also in those settings in which eye care is integral part of health, has given the opportunity of eye care professionals to be part of the response to COVID-19. So you see really the importance during COVID-19, how being integral part of the system, that you are integral part of the response in a situation like a public health emergency during COVID-19. We don't need to forget that it will be fundamental that we continue giving this message, we continue working together to make a reality that eye care and eye care interventions are part of universal health coverage, because then we will ensure sustainability of services. What has been also a challenge that we have been seeing over the last 30 years in many settings when services have been provided in parallel system, ad hoc, and not as integral part of the health sector. So again, relevant before, relevant during, relevant in the future for sustainability purposes. Thank you. Thank you, Caroline, and thank you also to Ambassador Webson and everyone else.
Thank you, Lakos. Can I then follow that up? It's great to hear it's still relevant. But then what would you think are the key priorities that we need to get after at both country and global level to successfully deliver on universal eye care for everybody?
So we need to make sure first that eye care is integral part of the health strategic plans, what it is not the case in many countries of the world. Second, we need to strengthen eye care services in primary health care, because there is how you can bring the services close to the people, to the community, and of course, strengthening also referral pathways. We need to make sure that we coordinate and strengthen primary healthcare workforce. And of course, we need to ensure that eye care information is also part of health information systems so that we can monitor progress and sustainability. That is on the country level. At the global level, I think advocacy is being fantastic. We need to continue doing that and making sure that eye care continue being a political priority in health and become even more. Thank you.
Thank you, Lakos. Reshma, I wondered, is there anything you'd like to add to that question?
Yes, thank you very much, Caroline. I think my addition would be, we've come a long way in looking at prevention and promotion. But I think as the World Vision Report has stated, our services need to be people-centric. And I think at a country level, we need to move to the full continuum of care. And what I often see when working as an NGO with government is that the issue around treatment and rehabilitation still remains neglected, whether that is putting on a pair of glasses or eye surgery. So I really think now is the time for us to encourage countries to move beyond prevention and promotion, which obviously is critically important, to the aspect of treatment and rehabilitation, so that we are able to close the continuum of care and address the issue of inequality, whether it's eye drops for glaucoma or treatment for trachoma, or as I said, we've heard many of our esteemed speakers talk about the fact that cataract surgery and refractive error correction is the most cost-effective intervention, yet we constantly see treatment and rehabilitation neglected.
Thank you very much, Reshma. I mean, I thought it's very interesting listening to many of the speakers focus on the SDGs and certainly talking about how eye health can contribute to SDG success. And we're only 10 years away, and the whole COVID situation may well have set us back on achieving those. I wonder, I mean, I'd actually like to start with Rosangela on this one. What do we need to do to make sure that eye health is included when people and governments are looking to deliver on the SDGs? Can we move to Rosangela? Looks like we may have temporarily lost her. So, oh, no, there you are, Rosangela. SDGs, what do we need to do?
Can you hear me?
Yes, we can hear you.
So thank you very much, and thank you for the excellent presentations. Hi, Alarcos. Hi, everybody. I just was thinking and adding and building on what everybody said. I think that for achieving the SDGs, this is our challenge. Everybody is focusing on it. UNICEF is contributing in many ways from the health. We have a strong internal partnership, which we consider extremely important, of the health, ECD, disability, and also the communication for development teams working together to put programs for children with disabilities, including the ones with visual impairments, from early identification and intervention through following necessarily with provision of services, and this is critical really. We cannot assess, generate expectations in families and not deliver anything and get numbers that don't talk to the users themselves. So this is a critical aspect of it. We are working very closely with the WHO on assistive devices. The AT partnership is a partnership towards achieving SDGs for children with disabilities. And the at scale brings together UNICEF, WHO, IDA for sure, the International Disability Alliance. We put persons with disabilities in the center of the process as decision makers, and also the donors, Norway and the UK and the US. And what we are seeing that it's really very important. While assistive technology like obstacles and canes and computers and softwares and all of these are all part, cell phones, of assistive devices that we have to get in the hands of people, we really need to make sure that ecosystems are in place in country to deliver these in a right way, not spending money that will not be used further to accelerate progress in the country in general and for the individual to have an impact in their lives. So we are working now with our sub-Saharan Africa region to probably in 7 countries starting very soon to start building these ecosystems in country level as well, not only for procurement, not only for receiving objects, right? Assistive technologies, existing assistive devices, but also to adequately fit them in the children and adults as well. So I think that to achieve the SDGs, we have to look at the whole system as a whole and make sure that all of the parts of this ecosystem is in place. And if we don't do this, it will be much difficult to achieve the SDGs and progress for these countries as well.
And Angela, can you also address one of the really important concepts coming out of SDGs and indeed the Convention for the Rights of Persons with Disabilities, the need to involve the community and particularly people with disabilities in looking at how we go about delivering eye health solutions. What do you think we need to do to make sure, particularly that people with disabilities are able to participate, not just access the health services, but participate in these questions about what needs to be done?
Exactly. Caroline, you know that when I mentioned our community for the communication for development team that we call C4D, what we do is exactly community engagement, right? And the idea is that after a child goes through the health system and gets into the community moment where family is critical and community members are critical to support this kid to move ahead, not only surviving, but really thriving as everybody else, we need to work on stigma and discrimination. That is the origin of exclusion, and it's maybe one of the most difficult barriers to remove among the barriers that exclude the people with disabilities. So we are developing in UNICEF, also we are working with various C4D partners and developing packages of recommended approaches to having the community, bringing people with disabilities to the center, identifying the families and not waiting for them to show up, but reaching out to them and bring them to participate in the community.
That sounds great. Thank you, Rosangela. And one last question before we go to the floor. Reshma, I'd just like to come back to you. Clearly, the private sector, we haven't really talked about yet, but it's got a hugely important part to play in bringing universal eye health to everybody. Could you comment on what we think we need to do to engage them better?
So I think, thank you, Caroline. I think first, many years ago, we did not have a lot of the evidence, but as we heard today, we have a lot of evidence that shows the economic impact, productivity on impact, productivity on vision. So I think we need to start using that evidence to show the importance of vision to the private sector. But we cannot stop there. I think it's really important for us to start lobbying them to show the value of vision care to their specific industry. Because at the end of the day, it's private sector, it's business. And they need to understand the value or the loss they're going to have if they are not at the table and not supporting it. And I would then, be so brave to say that at the end of the day, it comes down to costs, whether it's surgery, equipment, assistive devices, low vision devices. And so I think organizations like IAPB, Friends of Vision, the fact that advocacy has moved really along, we should start lobbying as a joint entity, as a sector, to bring these prices down. And I mean, tangibly, I will say, I'm sure there's millions and millions of rands, Caroline, between Sightsavers and all the other NGOs that is spent on eye health every year to the private sector. And so I think if we jointly start to lobby, we can drive prices down because economies of scale drives it down. But right now we go as an individual customer. So there's no benefit for them. They know they're going to get the business. And form those strategic partnerships so that we can drive the landed price down. And the other very strategic partnership I think we need to look at having is around shipping costs. We know whether we're on the African continent or in Asia, the landed cost of whether it's a drug or a frame or lenses becomes quite unaffordable when we add the shipping costs. And so strategic partnerships to drive that cost down will allow us to get to the end user at a much, much more affordable rate than we currently have it. So I think, it's all about lobbying as a joint sector rather than as individuals.
Sure. So we need to encourage people like Essilor to really engage, I guess. I'm probably going to stop you there because we haven't got too much time, and I do want to take questions from the floor. So I think the first person who asked a question is Ambassador Mitch Fifield, who's the permanent representative for Australia. Ambassador Fifield, do we have you available?
Yes, thanks very much, Caroline. And firstly, can I say more Stephen Fry is never enough. That was a great presentation earlier. But thanks, Ambassadors Webson and Fatima and Bern Nason for bringing us all together. And thanks to the panelists and the other presenters for a fantastic session. I really want to report that vision is a key priority for the Australian government at home and abroad. Just one example, we're proud to work with Indonesia to develop the World Health Assembly resolution on integrated people-centred eye care, which was adopted in August, and that's a really important platform for laying out what we need to do over the next 10 years. I just want to flag that support for eye health in our aid program remains strong. At the macro level, our broader focus is on strengthening country-level health systems and improving regional preparedness. And I also think it's great that last year's UN high-level meeting on universal healthcare was an important milestone in building political momentum, and the reference to eye health in the political declaration was a key achievement. So just some observations from the Australian perspective, but a question to the panel, if I may. Maintaining momentum, maintaining focus, everyone said it's even more important in the wake of COVID. And we've got all the data that demonstrates what has to be done. Obviously, national governments need to take decisions. I'll just touch briefly on some of the ways we're trying to contribute. And the United Nations has its role, and civil society has its role. how best to bring those three elements together, civil society, the United Nations, and the decisions needed by national government, how to harness those three together to make sure that the momentum is maintained. Thank you.
Thank you, Ambassador Fifield, and actually thank you for everything I know Australia, or the Australian government's been doing for eye health over very, very many years. I'm going to put that question, I think, to Alakos.
You know, and I think it's a very good question, and this is what I understand we are doing today. It always goes back to champions that have the really the power, the enthusiasm, and the knowledge how to bring different stakeholders together at all different levels. And then we have also front organizations like working at the country level that are also part of this partnership. At the end of the day, is really about leadership from individuals that can bring all the organization together and all the different levels together, as we are experiencing today, and under the leadership of Ambassador Webson.
Thank you, Alakos. I mean, certainly, I think if I say something on behalf of NGOs, it's really essential to work in partnership. I mean, for me, the really critical thing is that we always work with governments. We don't have NGOs trying to create parallel systems, which we did used to have, I think, more in the past than we do now. And also, you talked about data there, Ambassador, and I think that's also very important in making sure all our programs are as evidence-based as they possibly can be, and not just driven by belief, as perhaps they were. I think I'm not sure that we now still have the ambassador from Indonesia, who was on the line until quarter. I don't know if he's still there.
Yeah, you have me.
You are. Oh, thank you so much. Well, so Ambassador Koba, who's Deputy Permanent Representative for Indonesia. I know Indonesia is doing a tremendous amount of work in eye health, and I'll give the floor to you.
Well, thank you. And thank you, Mr. Wesson, for this meeting this morning. I just would like to reiterate that the improvement of vision is one of the key priorities in Indonesia's health sector, and we are committed to addressing this issue through international collaboration. I have two questions, if I may, 2 points. Equitable and affordable access to healthcare, including vision. Vision health is important to improve the delivery of eye care, and in this, how the private sector could contribute to improving the access to affordable technology and assisted device, because I don't think we heard enough about this narrative about the contribution or the that the private sector could give in this field. And also the executive director of UNICEF mentioned about the increasing number of children and youth doing a school from home. I myself at home, we have one son who just graduated from high school. The last semester of high school was done entirely from home, and the first few weeks of college also from home. So I know this issue firsthand. So how should we increase our with the increased use of gadget and electronic devices? Should we modify our campaign and strategy for the eye health? Thank you, moderator.
Thank you very much. I think Reshma did actually talk a little about the private sector, but I wonder, perhaps, did you want to add anything, Reshma, or do any of the other panelists want to add anything?
I think my addition would be, thank you very much for that, Ambassador. I think my addition would be that we need to also engage private sector to start to develop low-cost technology, but without compromising quality. I think, often we tend to compare the two, and once it's low cost, we believe it's not of good quality because maybe that's what communities have experienced. I think COVID-19 has shown us the importance of technology and the importance of making technology accessible to everyone, no matter where you are in the world. So I think, low cost devices at a good quality is something that we certainly need more dialogue about.
And I think, Caroline, that one needs to emphasize also in the collaboration with the private sector, the point that you emphasized before, the importance of not developing parallel systems of delivery, but really integration and coordination. And this will also require and requires the coordination and partnership with the private sector that we should not and never forget. That is one of the main key issues also in terms of sustainability for services for the future.
So it's really the three sectors, civil society, governments and private sector working together and coordinating. The second question is about the increasing use of digital technology. I'm going to be a bit cheeky here. I'm not going to go to a panelist. Is it possible to ask Ambassador Webson to comment on this? I mean, I know Aubrey used to work at Perkins School for the Blind, and so this is an area that will be very close to his heart. And I wondered if he'd like to make a comment.
Thank you very much, Caroline. One of the things that I have been known to say is that technology to a person with visual impairment or a person with disability is like the wheel in the industrialized age to mankind. That is how dramatic technology is in terms of changing the lives of somebody who has a disability, or particularly a person with visual impairment. So we have, and we are experiencing it more and more in the COVID time. And we are seeing that without technology, the person with disability could not be as efficient or as effective in being included within society. So I think getting down the price of technology, which is something we've been saying for years, and certainly creating access to technology of all kinds to all persons with disabilities, wherever they are, and to persons who are visually impaired, is critical in our transformation in terms of achieving the SDGs and in our effort to provide visual opportunities and visual eye health services to any society.
Right, thank you very much, Ambassador Webson. Next, I'd actually like to go to the First Secretary, Mudita Bhattacharya, who is the permanent mission of Nepal. Can we have your question, please, First Secretary?
Thank you, Caroline. Thank you for giving me the floor. Actually, it is not my question. I would like to make few remarks. And first of all, I would like to thank Ambassador Webson for organizing this event, especially the UN Friends of Vision, for this timely high-level event. And we appreciate the group's effort in highlighting the issue of vision to the United Nations. As the newest member to this group, Nepal hopes to learn from the good practices on vision from fellow member states of this group. I also thank panelists for their insightful discussions on the importance of eye health care, making it affordable, ensuring its quality, as well as its fundamental role in achieving the Sustainable Development Goals. Vision has direct positive correlation between attainment of children's education, productivity, and mobility of adults, social life, addressing persistent inequality and poverty. The government of Nepal has long been partnering with NGOs in providing eye health services. Today, the prevalence of blindness in Nepal has decreased to 0.3%. It is 7,000 out of a population of 29 million. Last year, Nepal became the first country in South Asia to eliminate trachoma. Cataract and other preventable cases can now be treated much earlier with modern surgery. The government's 2019 health policy also clearly spells out that primary eye care service is fully integrated into government health care delivery system. I once again thank the organizers for organizing this high-level event. Thank you.
Thank you very much, First Secretary. I'm afraid we've reached a point where we're out of time for this session. We were going to go to Mike Hoden, who's the CEO of Global Coalition on Aging. So, Mike, what I will just say, from what you said in the chat, it's very important that we collaborate with older people globally, particularly linking in with the goals of the Decade of Healthy Aging. So I did want to make sure that that got aired, but I'm afraid we haven't time to go to you. We've had a lot of Q&A, masses of questions, both in the chat and on the Q&A. I promise we will answer them after the event. We'll go through them all. But for now, I just say thank you so much to all our panelists and to all the ambassadors. And I'll hand now back to Ambassador Webson.
Thank you.
Thank you. Thank you very much, Caroline. These events, of course, we never really have enough time for the numbers of questions and the enthusiasm that we get both here and from around the world. We want to thank everybody for your participation. Caroline, thank you so much for leading this session, and the thanks to the members of the panel for their incisive discussion and for the answering the questions. Colleagues, I am pleased to share that while Her Royal Highness Sophie, Countess of Wessex, is not able to be with us this morning live, she has contributed to the event by sending a video statement. Her Highness is a tireless advocate for improving vision worldwide and is the royal patron of our friends at the International Agency on Prevention of Blindness, IAPB. We will have some closing remarks by Her Royal Highness Sophie, Countess of Wessex, GCVO. So Her Royal Highness, please.
Your Excellencies, ladies and gentlemen, it's a great pleasure to be able to address you at this Friends of Vision event. I know everyone here shares a passion for striving to improve the lives of those with vision and eye care issues. Over the last few decades, we have seen tremendous progress on vision, with 90 million people having been treated for or prevented from vision loss. Onchocerciasis is on track to be the first blinding disease to be eradicated globally, and across much of the world, eye health services have been strengthened so that people of all ages do not lose their sight when it can be so easily avoided. The year 2020 represents a significant milestone for vision. It marks the conclusion of the two-decade global initiative, Vision 2020, The Right to Sight, of which I am privileged to have been a global ambassador. I have seen for myself the incredible impact good quality eye care can have on lives, turning them round from an existence of dependency to a life of independence. When the Queen Elizabeth Diamond Jubilee Trust was created in 2012 to mark the contribution made by Her Majesty as the head of the Commonwealth, it was tasked with enriching the lives of people. I had the honour of being the Trust's vice patron, and in just 5 years, the success of the Trust saw the lives of millions of people not only enriched, but transformed through the gift of sight. When I travelled to witness the work of the Trust in action for myself, I met patients in Malawi who, after suffering from blinding trachoma for decades, were finally pain-free and able to see. Young girls in India who were born with sight-threatening eye conditions but are now growing up as if nothing had happened. Tiny premature babies who, through being born so early, were at serious risk of developing retinopathy of prematurity, but with timely screening will be able to live fulfilled lives. Patients with diabetic retinopathy who have had their condition brought under control, and whole communities being given public information about how they can support their families. All of this incredible work, under the guise of Vision 2020 and the Queen Elizabeth Diamond Jubilee Trust, has been brought about through the collaboration of governments, ministers, eye care professionals, medics, NGOs, civil society, and many thousands of individuals who understand the importance that eye care plays in creating healthy, forward-moving communities. No longer should it be acceptable that vision loss is just a condition that is untreatable or merely the luck of the draw. The gift of sight enables everyone to live their lives to the fullest, releasing their potential to learn, to work, and to lead fulfilled and productive lives. This makes it fundamental to global prosperity and the Sustainable Development Goals. Thank you.
I thank the Countess for her statement. And colleagues, I would like to thank all of you, my fellow ambassadors, fellow members of the diplomatic corps who are here with us online, the members of civil society, and the many friends who joined us. This has been another stimulating event, and an event where we have learned so much. We are putting a major effort here in getting attention on vision. Caroline said something that I have been saying, and I wish to follow through with her statement that while we are down in the dumps, if you might, around COVID-19, while we are swamped in trying to find a way out of COVID-19, other things in the world have not stopped. Climate change has not stopped. Eye health need for services in developing countries and around the world has not stopped. We cannot be derailed totally. We have to be inclusive. Everything we do, we have to pick up what was left and bring it together with what we have. I would like to see, and I will be speaking to my colleagues about us putting on another event early next year where we would bring together the United Nations groupings here, government, civil society, the private sector, but the private sector in terms of those who are directly involved in industry around eye health, and very important, those who are involved in finance, both through multilateral and bilateral financing or private sector financing. We must get the finance community into the discussion. And if we didn't learn anything from COVID, we certainly know that the COVID-19 pandemic has set us back economically in many developing countries and many countries around the world. And we got to get them speaking about how we can continue to find resources to address what is one of the greatest global challenge facing us. And that is the loss of eye health services and eye care need in our communities. We will try to pull this together next year because we cannot complete and cannot achieve the Sustainable Development Goals without a full recovery. And that means without making sure that eye health and the track that we were on 8 months ago is not lost, that we continue to pick up from where we left off as we drive forward in ensuring that all have an opportunity for appropriate and good eye health services. We must reduce car accidents. We must reduce childhood blindness. We must reduce needless blindness. We must reduce needless, we must provide cataract services that is necessary. We must ensure that all have access to universal health, which involves and includes universal eye health services. I want to thank all of you for your participation. I want to thank the members of civil society who have worked with us in making this happen. And thank you for a really good event this morning. Thank you.